Hello, everyone, and welcome to Talk with a Doc, the show where we bring your questions to Providence medical experts for insight and information. I'm your host, Mary Renouf, and here with me today is Mary Ann Dunlapp, a family medicine nurse practitioner at Providence Medical Group in Oregon. And today we're answering your questions about wellness exams. Remember, everyone, all of our questions come from our listeners via social media. We can be found on Twitter at PSJH and on Facebook under Providence St. Joseph Health. Use the hashtag #TalkWithADoc, that's hashtag #TalkWithADoc, for your chance to hear questions on our future episodes. Before we start, I want our listeners to know that the information provided during this program is for educational purposes only. You should always consult your healthcare provider if you have any questions regarding a medical condition or treatment. All right, let's get started by welcoming our expert today, Mary Ann Dunlapp.
Hello.
Thanks for joining us.
It's good to see you.
Well, we are talking about wellness exams today, and I think there's a lot of questions out there about, is a wellness exam an annual exam? Is it my physical? What is it? And so let's start at a very high level. For those listening, how do you define a wellness exam?
So it's your preventative care visit.
Okay.
So whatever that consists of for you at your age. So I know one of the questions that your folks had was, does it vary from age 20 to age 40 to age 60? Right. And it does. So different things are going to be important at different times. My specific focus actually is wellness exams for those 65 and older. So I do Medicare wellness visits. That's my special focus now in what I'm doing. And so those consist a lot of safety issues and things like depression and eating, exercise. So it's really a lot of discussion and education around wellness and best health practices and preventative care, like what immunization should I have?
Right.
That kind of thing.
Especially in that age group, because they're like, do I need the flu vaccine? Do I need pneumonia vaccine?
That and the youngsters. So that and the little guys. So in between tetanus shots are probably the biggest thing that our age group gets. And then also for women, pap smears, and things like that can be really important. But for men, actually, there's a kind of a golden age, when they hit after puberty and then until their 50s or so, they have very few things that they really need. I think cholesterol is a nice thing to look at and monitor, blood pressure, weight, exercise, and things like that. But there's not a lot of actually hands-on physical exam that they really need. Heart and lung check every so often, blood pressure, that sort of thing.
Maybe their skin if they have a mole or something.
Sure, yeah, things that they're seeing. And then the education around what should you be looking for and things like that.
You're telling me men have it easier in life?
I think us ladies, we've known that for a while.
I think we've known that.
but we're really moving a little bit away from this hands-on idea and really talking more about what keeps us healthy. Yeah, so even depression screenings and those sorts of things may be more important, in those middle years than actually, listening to heart and lungs and that sort of stuff. That should happen every so often, but...
Well, sure. How has that changed over the years? Because I think, 20 years ago, we weren't doing depression screenings or mental health screenings, but now it's part of something that primary care physicians are asked to do. How's that education look? How has it changed?
Yeah, that's true. I just think that there's just much more awareness now that those are big issues. Yeah. They're not so much pushed under the table anymore. They're actually in the forefront, and we need to talk about them. And I don't know, sometimes I wonder, has stress and depression increased? I think that's a good question. Right. It's hard to say, but definitely we talk about it more. And we have more options now. There's certainly medications. Therapy is becoming more accepted and more available. And luckily, most insurance companies are now covering those sorts of things as well.
That's really been the biggest thing, right? Parity as to your mental health care versus regular physical health care.
Right. And that's the other thing, too. I mean, we have got to move away from the idea that mental health care is something different than your overall care. Right. I mean, it's part of your brain, your brain chemistry, what you're thinking. That's all part of your whole body experience. So
your mental health impacts your physical health impacts your mental health.
Everything. Yeah. Right. So it's really, really important. And I don't know whether it's that it's more prevalent than it used to be or whether we're just talking about it more.
I hope that it's just that it's more accepted.
Yeah,
right?
I agree.
Absolutely. Well, so you talked about this kind of what it is. I think a lot of people would call that a physical. Is that standard language?
Yeah, so it's really interchangeable. A physical and a wellness exam now are the same thing. It's just that you're not going to see maybe as much hands-on, and you're still going to have a variety, though. you know how providers are all very different, and so they all do a lot of different things. You still may get it's this full head-to-toe physical, sure. And that's fine too. It's just that we're moving a little bit more away from just that standard idea of head-to-toe physical is what's really important.
Right. Well, is a pap smear part of a wellness exam, or is that separate?
It can be. So, it's, again, if we're talking about your total wellness, a pap smear for a woman at a particular time might be important. So once every 3 years for most women is standard. However, you've got to follow the directions of your provider, because if you have any abnormalities, then there's going to be a different schedule. Sure. And it's really important, because if you follow that schedule, definitely they will be able to handle things at an early, early and in a fashion that will keep you healthier. So,
I tell people that I was on the every 2-year plan, and I for some reason felt like I needed to go in after only a year, and that's when they determined that I had the early stage cervical. And what if I had waited 2 years, right? And that was just a gut feeling. But my doctor was she said, sure, you're on a 2-year plan, but let's do it, right? Like, why not?
That's one thing I learned too, is that when somebody comes and tells you something, a lot of times you just have to listen. I mean, I learned that pretty early on. It's not all about the guidelines. You just you've got to take the person in front of you and listen to what they're saying and go with that as well. But the general guidelines are, once every 3 years, or based on what your findings were.
Sure. How has Dr. Google changed the wellness exam? Do people come to you now with here's the 15 things I have?
Oh, that's a good one. I think it's really difficult because people are more educated, but sometimes the hard part is the behind, what's behind what they're reading. So the science behind it. And, we go to school for a long time to learn about all those little detail things. And so it's really hard to explain to somebody without sounding, oh gosh, a little bit arrogant, where you say, oh gosh, but all these little bits and pieces behind it lead me in a different direction than where you're going. And it's really hard sometimes to explain that without sounding like you're trying to tell somebody you don't know what you're talking about. But I think it is, you can bring stuff up, but realize too that there's a lot of background information that we've got from just, all that years of education. So listen to us too, as well as Google.
Well, Google is an algorithm. Let's remember that. Your physician is actually a human with a lot of training.
Right.
How should people prepare for the exam? Do they bring you a list of questions? Do they just tell you how their health has changed?
This is the best question, because I think a lot of times you'll see, like on the Today Show or somewhere, that bring in your questions. And it's fine to bring in questions, but remember that those may be prioritized to another visit.
Sure.
And I think that that's really important, that people don't feel like they're going to get everything maybe done in that one visit. Unfortunately, we would love to, but there is time limitation.
Sure.
And we want to get to the preventative piece for that visit, because it is a prevention visit. But what we can do is prioritize another visit and get you set up for that, maybe in a week or 2 weeks or whatever, to come back and talk about other issues. And we can even put those in a priority so that we can set up visits in the future for those.
And maybe some of them are even referrals to other people, right?
That's true too. And the other thing is it's not that we can't look at, like if you have a mole you want us to look at during your physical, that's fine. If we need to remove it or do something like that, that may be another visit. Little things are generally okay. It's just prioritizing maybe a brand new problem. Sure. Like I have this new knee pain, or those sorts of things. We may need to have you back so we can do X-rays, et cetera, whatever we need to do.
I think that begs the question, how long is a typical wellness exam?
About 30 minutes for most people. The Medicare visit is about an hour. It's a little bit longer.
And why is that?
We do a little bit more screening.
Sure.
So we're doing a little more testing on balance and falls, and a little more education, I think is what we end up running into with those visits. And then as people get older, sometimes they have more chronic conditions that we want to just, it's not that we manage them during that visit, during the preventative visit, but we want to make sure that we're all on the same page. So maybe we need to create a listing of, other appointments that need to be made.
And is a lot of this related to, say, a population health perspective of we just really want to decide, you might actually be pre-diabetic, and that's going to be very costly if we don't catch it early? Is that the idea behind wellness exams?
I think generally no. So generally speaking, your wellness exam really is more focused on your health, your preventative care, finding things early and doing things that will prevent disease or conditions from occurring. However, it is important for us to know how well or unwell you are from the perspective of cost, because that helps us to have the appropriate amount of dollars given to the health plan so that they don't have to raise premiums.
Right.
And that's what we don't want. We don't want premiums to go up for our clients.
It's not good for anybody.
No.
Nobody
likes that. So that's the kind of administrative piece. And I have to tell you, it's not every provider's favorite thing to do that, but I think it's important because it's about cost. And that is something that is transferred on to our clients and our patients.
Absolutely.
And we don't want that to happen.
Absolutely. Well, I'm going to combine these two questions we got because the first was, do I need to fast before I go in? And the second is, do they do lab work and blood work? And I assume those go hand in hand.
Yeah, sure. So if you have an early morning appointment and you have any desire to have labs and or think you may need labs, you can fast. It might make it easier so that you can get them done that day. But we can certainly order labs and have you come back at any given time for those. And you can usually come back to any, if you're a Providence, coming to a Providence clinic, then you can come back to any different Providence clinic because we're all connected.
Nice.
Our computers are all connected.
Well, it's like Redbox. I can rent at one and drop it off at another.
Right. So you can come to your doctor who might be in one city and you happen to live in another one, and you can go there for your labs if you want. So it's not necessary, and I would only recommend it if you were coming in for an early morning appointment or if you absolutely knew you were going to have labs and you were okay with fasting.
Fasting all day. Well, do I have to have a primary care physician on record to get a wellness exam?
That's a tough one. Yes. Mostly. I don't know of many cases where you wouldn't have somebody that is your primary care provider do them. And I think another question is kind of at these clinics that are set up in Walgreens or immediate care clinics, do they do them? At this point, they're not, other than very specific types, like a sports physical can be done at an express care, a school physical could be done, but just a general preventative physical would usually be done at your doctor's office with your primary care provider. And you may not even see that person but once a year because you're so healthy, or maybe even once every couple of years. But it is nice to have somebody set up in case you need them.
Sure.
So I always recommend getting a primary care provider.
I think it's interesting talking about primary care providers because we do a lot of research, and what we're finding is that millennials don't have a primary care physician. And what we're finding, though, is that they really need to, because when they actually need healthcare access, they don't have anyone, and there's no medical record to go back and look at.
And that's exactly what I'm talking about. It's nice to have somebody set up, not just for your physical, but if you ever need them, and you never know when you might need them.
Isn't that the truth?
Yeah, right.
If only we could guess.
Yeah.
Well, if I go to my doctor for my wellness exam, should I bring my family medical history? Should I bring my list of medications? What do I bring?
Yeah, so if you're already set up with us, typically we're going to have a pretty accurate list of your medications, but every physical we will certainly review those as well to make sure that it is, that we've got that accurate list. Bringing your medications isn't a bad idea, just bringing them all in. Even supplements that you take over the counter, really good idea just to bring those in so we can see what you're doing. And family history is always great to know, and your own personal history, surgeries, things like that.
Right.
Yeah.
Well, you did talk about maybe the depression screening and other things. Are there kind of a list of screening items that you go through there that people can be prepared for?
Not necessarily. Again, we're kind of more age appropriate, so we have an idea of what we're going to be looking at. Again, like I said, there's this kind of area for men in the middle of their years where you're looking at mostly just blood pressure screenings, cholesterol, tetanus shots, really basic stuff like that. Women is going to be a little more interesting. If you let's say you had a pap smear from an outside source as a woman, like a gynecologist, and you're coming to your primary care doctor for just a physical, maybe in those in between 3 years that you don't need a PAP. It's really good to have that information to bring in for them, that sort of thing. So they know that you did have that PAP smear done and that you're all up to date on that. And I guess that's what we're really kind of doing, is collecting information to make sure you're up to date on things. And then if you're not, we want to pick those things up during that visit. And so again, it's going to vary based on your age.
Give me an example of what a wellness exam would look like for a woman 45 years of age.
Yeah, so probably a lot of discussion around health behaviors. So exercise, what you eat. Of course, are you up to date on your pap smear? Mammogram. So that's another controversy, starting at age 40 or starting at age 50. But what I think we'd like to do is have discussions with patients. We like to talk. What's your family history? What's your personal history? We get a lot of information, and then we help make a decision around that. Like, should you start now? Should you, wait till 50? Right. That sort of thing. So really, it's very individual. It's very focused on the person sitting right in front of me. And so it would be a lot of discussion first, and then usually I would do some sort of hands-on. I'm going to check your blood pressure. I'm going to listen to your heart and lungs. If we need to do a pap smear, we'll do a pap smear. Breast exams, we're still doing those, although there is some information that those may not be terribly useful. I know that, and it is so controversial. There's a lot of controversy around what we do and don't do.
We can do a whole segment just on that, right?
So that's a tough one. But again, part of it that's really important is having the discussion with you about what's important to you. So if I say to you, the U.S. Preventative Care Task Force says that breast exams aren't necessarily helpful, and you say, but I would like one, and then I say, sure. You know what I mean? So I think it's a lot about who's sitting in front of you. But yes, depression screenings, blood pressure screenings. Should we have a cholesterol because it's been 5 years? Those sorts of things. That's what we're going to talk about.
This is great information, Mary Ann. Thank you so much for being here with us. We're going to take a quick break, and when we come back, we're going to continue the conversation about wellness exams.
Everybody's talking, overthinking what they think. Their opinions coming strong, but I lose them in a blink. They say I'm not good enough, they're not someone I can trust, 'cause I know I'm good enough in my heart. They tell you who you should be, but you were born to be free. So be who you wanna be, 'cause you're perfect, imperfectly perfect. You're perfect, and you know you're worth it. No one can take your place. No, you don't have to change. You're perfect, imperfectly perfect.
Back with Talk with the Doc today with our guest Mary Ann Dunlapp, an adult nurse practitioner from Providence in Oregon, and we are talking about wellness exams. You've given us a lot of great information. We got a lot of great questions around costs, so let's dig into that category.
Okay, yeah.
So are wellness exams typically covered by insurance?
Yes. So as part of the Affordable Care Act, they really bolstered preventative care, which makes so much sense. I think that everybody agrees that that is a good way to spend money, prevention, keep people healthy.
Sure.
So most visits, preventative visits are generally covered under most insurance plans, and I think they may have to be as part of the Affordable Care Act. And the Medicare one that we do is, paid at 100%. And
Right.
that's the other thing. There usually isn't a copay with them either. It's usually 100% covered.
Oh, that's good. We got that question a lot.
Yeah, and Pap smears, mammograms, those things are also covered at 100%.
So if I were to get lab work done during that visit, would that typically be covered, or would it be variable?
Variable. So most plans will cover some specific things. Like I said, I alluded to before the idea that there is a task force that actually talks about when screening should occur. And so some insurance companies will follow along with their guidelines, or maybe the American Academy of Family Practice guidelines, or the American Cancer Society guidelines. And so they have their specific intervals at which they want to pay for things. The easiest thing you can do is actually call your insurance company. I was going to mention this before too.
Smart.
Before I just make a blanket statement that everything's covered, I must always say,
Sure.
You should probably call. I don't want to give anybody.
It's going to vary.
You're right.
Sure.
You're right. But calling your insurance company will let you know. I know that most plans, though, really are covering preventative care well, and labs are slightly different. And sometimes you want labs too, because you're having a particular problem. So how we talked about what if you come in with a list of things? Well,
Right.
maybe you come in and tell me you're fatigued, which is probably one of the number one things I hear during visits. We might want to do some labs that wouldn't be considered preventative, but they're
Got it.
important. So they may actually incur a little bit of cost, whereas your preventative visit is covered at 100%. So just know that. There may be some labs that aren't covered at 100%.
Now, you just mentioned kind of a task force advisory council. You're on that for Providence, correct? Aren't you one of the leaders?
Not that one particularly. So that's a big one.
Oh, okay.
So we have these really big task force in the U.S. where these really smart people get together, and they actually will take a topic, and it's so interesting. Like they'll take breast cancer prevention and screening, and they'll just hash that out for a year or better.
Yeah.
They'll just sit around and look at all the data and all the information that they have, and then they'll finally come up with an advisory or recommendation. They'll give it a grade, like A grade being the best and F grade being don't do it, and then they'll give us little information in between, like prostate cancer screening is a good one to talk about because it's kind of gone multiple
Right,
different ways.
right.
So PSA screening was seen to be the best screening we had, and then it was kind of like out of popularity for a while because we found that it was really there's a lot of false positives with that test, and so
that'd be scary.
Right. So then the question was, are we doing unnecessary biopsies and things like that? Well, we've kind of come to a middle ground now with this idea of shared decision making. So that's the thing you'll hear a lot of people talk about, where we're talking to patients, about this. You may find it is the only screening we have, but we have a lot of false positives with it, but we're not going to jump to a biopsy right away. So that's the new sort of recommendation, is have a shared decision making conversation. Don't just write it off completely.
Right.
But that's what this U.S. Preventative Care Task Force does, is they give us information about what's the best way to approach these preventative measures. Now, that may differ from what the American Cancer Society says.
Right.
So as a provider, you've got to kind of take, each guideline and kind of meld it into what you feel is most appropriate for that person sitting in front of you. And I'll keep coming back to saying that. You're looking at that one that's sitting with you that day. So that's what's important.
Each physician, though, can take, or each clinical expert can take that recommendation and then decide how they engage. And I asked this because when I was in Seattle, I was on a 3-year plan for Pap smear. When I moved to Portland, my new doctor said every 2 years.
Yes.
And I had only aged 6 months, right? So it couldn't have been too big of a difference.
Right. And that's what I mean exactly. You'll get people that have differing opinions, but they're basing them on some sort of guideline. So we all try to use some sort of guideline, but the guidelines may be different based on which expert source you look at, and then also how you interpret your particular findings. So I think that that's really important, is that people recognize that there are multiple different guidelines out there, and then there's multiple different people that are going to sit in front of you and be your patient that you're going to want to treat individually.
And I assume some of them are more adamant about certain things than others as well, right?
Yes, exactly. And I think that we have to respect that, and we also may be adamant about something. There may be something that a person wants that really is out of the realm of norm, and we may say, I'm just not the best person to do that. Like, for instance, some naturopathic stuff, I don't understand how to interpret some of those tests. So I'll say, it's not that you can't do it. I'm just not the best person to provide that service for you.
Can you call my dad and convince him to get his colonoscopy? Because he really said he only needs it every 3 years. I disagree. So can we call him when we're done?
Oh my gosh. Well, you might need to give me a little kick on that one too. Colonoscopy is honestly one of the best screening tools and tests we have available. It is by far one of the best tools that we have out there to prevent colon cancer. And it actually prevents colon cancer, not just finds colon cancer. So that test it should never be skipped.
I agree. But most people do because it's not a fun one.
It isn't, but there are so many options now too, and I think people they need to be educated too. The procedure gets better and easier all the time.
True. Yeah. Well, and things do evolve. So
right.
We've talked a little bit about insurance, but people have asked, if I don't have insurance, can I still get a wellness exam? Do I just pay out of pocket? Are there lower prices for those who don't have insurance? A lot in that question.
Yeah, well, some places do have lower prices, and so part of that is just going to be as a consumer. When you don't have insurance, or I think it's like anything else, you would probably, price things.
Shop?
Yeah, exactly. Like you would as a consumer for any other service. And there are people that do sliding scales type stuff. And then there's ways that you can, like for women's health care exams, the one thing that we like about some of the places like Planned Parenthood is that a lot of what they do for sure is wellness stuff. And that's one of the things that's just indispensable, truly, is to having clinics like that who are offering up services to women. And even they may even have vouchers for mammograms and things like that through like Susan G. Komen and stuff like that. So there are resources, and even if you have a primary care provider and you're still paying cash, a lot of times they can offer up resources as well, and so can health systems. A lot of times they will help people within some sort of sliding scale situation if need be.
I know Providence
we
is very
try.
much about that.
Yeah,
absolutely.
Yeah, so we're definitely about people who are vulnerable, and we want to make sure that they get their care too. So at least ask, always ask and see what we have to offer.
Well, this question was, can I get a flu shot during my wellness exam?
For sure.
Nice. Well, that was an easy answer.
Yeah.
Boom.
Yeah.
Okay, good deal. Go get one.
Right.
Everybody should have one. Well, not
Yes.
everybody, but within reason.
Right. Most folks should.
Right. So as a clinician, I assume that you're very busy. Do you block your schedule to have wellness visits every week or is there an amount of time? Because I would assume some people are thinking, oh, sure, I could go get mine, but it's going to be a 6-month wait. Do you guys block out times for these things?
Yes. Absolutely. So I would hope that people wouldn't find it to be that long. I know in some cases it can be. Around here, I would say generally speaking, we don't see that as much, maybe a month. But yeah, we do definitely block out extra time for those. Mm-hmm.
And I assume there aren't docs who just do wellness exams, because then you wouldn't really know that patient ongoing. But are there doctors who like to do wellness exams or do more of them than others?
Well, this is the interesting thing. I would say no generally, although that's what I do. So it's interesting. Our small group of providers, we have 4, 2 physician assistants and 2 nurse practitioners in our group. And we actually only do wellness exams. Again, it's for that Medicare population. Right. And it's to help because this visit is a very long visit. So people may question, so why am I seeing somebody who's not my provider? And it's really because this is an hour-long visit, and to chunk out that amount of time out of a busy provider schedule makes it really difficult for them to see people in follow-up for their blood pressure and their diabetes and all those things. So we don't mean to replace that person, but we're there just to help and kind of get this visit done. And then we package it all up and send it to the provider.
Oh yeah, that was my next question. How do you work with their provider then?
Oh, so the really nice thing is that we tend to be at the same clinics over and over, and so we work as just a team member. We're just part of your team if you're a patient there, and we just happen to see you once a year for that one visit. And then we chart the visit and kind of give them a little bit of information about all the things we talked about and the things we did, and then we just are able to send that to them via our electronic medical record, which is really integrated and wonderful. So,
and is that my chart as well?
Well, my chart has some information on there. You can schedule your appointment through there. It may remind you that you're due for a wellness visit.
I'm a My Chart junkie.
Right,
I use it for everything.
Right, and what you may need. And they do send you even some pre-documentation that you can, put in your health history and things like that with
all of your supplements. Yeah.
But I just send usually just a regular note to your provider that, hey, you had a wellness visit and these are the things we found and the things we talked about. And I may even set you up an appointment with your regular provider if we find that your blood pressure is out of control or your diabetes is a problem or you're having new knee pain and we need to get you in there. So
that makes it nice for people.
Yeah, we're really just we're doing everything in that one visit.
So how do they get referred to you for that? Is it their physician who's sending them over to you?
Multiple ways. Okay. So their physician may recommend, hey, get into that wellness visit with the wellness provider, or we actually do outreach for folks on plans that like Providence Health Plan. We do outreach for those folks because we think it's a really, really valuable visit. And so you can call in yourself and ask for it. So a patient can call and say, I would like my annual wellness visit. visit, my Medicare annual wellness visit, and you may get set up with your own provider or one of us, and they will actually let you know right then, of course, if it's going to be with your provider or with somebody on our team.
Is it required for Medicare patients?
No, it's not. It is a free benefit to you, though. It's an absolutely free visit, and I think there's a lot of benefit to it. I will say some people who are very, very healthy may benefit from it once every 2 years. We're not sticklers. We just want what's best for that patient. So I think most people every year should have it, but some people will do well with once every 2 years.
My mom is doctor avoidant, so she got the call that said, you need to come in. Like, at least see us every 3 years, lady.
Right, and that, I would say there's even some that are that healthy.
Sure, yeah. Well, one of the questions we got was, will I see a doctor or a nurse? Can you talk a little bit about the types of clinicians you see as a wellness exam?
So usually for the typical wellness visit where there's going to be some hands-on involved, where we're going to listen and we're going to talk about diagnoses and do that sort of thing, it's going to be either a nurse practitioner, a physician assistant, or MDDO, so a doctor or and what we call advanced practice clinicians now. Gotcha. And traditional Medicare does have an annual wellness visit as well. So that's a Medicare where a person hasn't bought a supplement plan.
Okay.
And that traditional may be done by an RN because there's really not a real hands-on component to that one. That one's more of just the screenings and education piece.
Got it.
So they can do all that, and that's oftentimes done by an RN.
Okay. One of the questions we got was, what if my doctor's rushing me and I don't feel like they have time for my questions or concerns? So should they schedule a follow-up? How does that work?
Yes. So that is such a good question because I think it's uncomfortable for everybody,
Sure.
And so I would say this, it's kind of the expectation that you have going in, like when I talked before about should you bring a list.
Right.
I think one of the important things is that you don't save up everything for that visit. And I think that we've gotten the impression that that consumers have the impression that that's fine. And so what are they going to do? They're going to do what,
Sure.
again, they've heard, bring in your list, I'll just keep jotting it down.
Sure.
So it just doesn't work that way in the real world. So what I would say is if you're finding that your list has 2 to 3 problems on it, it's probably a great time to just go to your doctor and handle those 2 to 3 problems.
I feel like you're talking right to me because I'm that one who goes, okay, here's the 4 things that have happened to me in the last 6 months.
Right. And, we certainly try to accommodate. Honestly, I think
Sure.
we all try to accommodate that, but it is difficult. And so I think that is the idea. If you have a couple of things coming up, come in for a visit for that. If you have a couple of things that you want to talk about during your preventative visit, that's usually okay too. But do expect that you may have some of those also set off to another
Sure.
visit. Just prioritizing is kind of what we try to do.
Well, we're almost out of time, so I'm going to ask you kind of, we don't want to bring you a list, but what are the things that we should ask you, or what are the things that we should make you aware of as we see you in this exam?
Okay, so for a preventative visit, I think it's, wanting to know, how do you see my general healthcare provider? I mean,
Right.
How do you see where I'm at right now? What are the areas that you could see me improving for better general health overall? I think those are what you're really looking at in your preventative visit. If you think about it and you think about it not being necessarily about problems per se, but staying healthy.
Right, getting ahead of things.
Yeah, so I think that's the sort of thing that you want to talk to your provider about is what sorts of things can I do to stay healthy and be well and feel good.
Is there anything I shouldn't be bringing to the table? Like I shouldn't be bringing X, Y, and Z? Any questions about like my mom's health or?
I mean, I think you can always bring anything to your healthcare provider that you think needs to be addressed.
Mm-hmm.
You just know that they're going to, try to get you the right information and where to go with that. Sure. So they may not be able to solve the problem, right. But I think, if you feel like it's really affecting you and you want to talk to somebody about it, it's fine to bring it up to your provider. They may suggest, counseling.
Sure.
Providence has a lot of counselors, which is really great, like in-office counseling. So that's
amazing.
That's great too. So we can prioritize and figure out where you need to go with this stuff.
Wonderful. Well, this was a lot of valuable information. Mm-hmm. We thank you so much for joining us today and to everyone for listening and sending in your questions. We look forward to future topics with more experts from Providence. Make sure to follow us on social media at PSJH on Twitter and on Instagram and under Providence St. Joseph Health on Facebook. To learn more about our mission, programs, and services, visit future.psjhealth.org. Thanks for listening.